Hello, everybody. It's really, like I said in the beginning, it's nice to see some familiar faces and to see some new faces as well. So thanks for having me here today, Carl. So first of all, I would like, since we're a small group, we can do this. We'll do, if you wouldn't mind, putting in, I don't know if you've done a waterfall before, but I'm going to ask you to type something in the chat. But before you hit return, wait until I say go so that they'll all happen at the same time. So since we all have our names here on the screen, we don't need to do that. But if you could type first your role in healthcare, whether that's, if you're a faculty, what school you're at, if you're not at ETSU, it seems like a lot of people are, or maybe your area of expertise in nursing. So put that in the chat and wait before you hit return. And give people a couple more seconds. And ready, hit return. Okay, great. All right. So the next one is something that you hope to take away from our time together. So it can be something simple, or just you need that certificate of participation, or something something new that you want to learn or contribute. So something that you hope to take away from today. And ready, hit return. I like that. Something I didn't know about before. That is always good. So, all right. Excellent. And the last one, please type a gift or a strength that you bring to the world. It can be that you just bring to your teaching, or just in general, gift or strength that you bring to the world. And don't type it yet, or don't hit return yet. And 1, 2, 3, return.
It's hard to pause on the return.
I know it, because you're used to, because we're typing so fast all the time, right? And gotta get it out there. Great. Great. Well, I mean, it seems like we're in like company, people who are really invested in empathy and who already have developed those skills or have it as an innate trait as well. So that's excellent. Thanks for that. So, all right, now I'm going to share my screen. And Carl, when I do that, I don't know that I'll be able to also see the chat when I have people respond to things. So maybe you can help me with that. But I'm going to go ahead and share my screen and get sound on. There we go. Okay. So, and I think this was in the write-up, but what are we going to do today? What are we going to talk about? And, I imagine that a lot of this is not new to most of you, but just as part of kind of an overview, we're going to talk about cultivating empathy through story, reflection, and dialogue, as well as actionable strategies for empathic care and communication. We're going to talk a little bit more about what is empathy exactly, why does it matter, especially in healthcare. We're going to talk a little bit about the science behind it. We could do a lot, but we have an hour, so I feel like I'm going to be touching on a lot of things, but we'll talk about the science, the neuroscience behind empathy and its impact on the quality of care, but also on caregivers, so patient outcomes and staff well-being. We're also going to talk about what are some of the barriers, sometimes perceived barriers, sometimes very real barriers to practicing empathic care, and then some evidence-based tools and practices for cultivating and sustaining empathy and compassionate care. And these are kind of hopefully the things that will be some of the outcomes from this. But I wanted to start with a story, and I think you may have heard this before, but I think if I'm talking about storytelling, it would be as one method of cultivating care. I'd like to start with a story. So it's not a story that you'll see in a textbook. It's not the kind of story that makes headlines, but it's the kind of story that teaches us something real. something essential. So Kathy, is a real person, was a nurse. She was hardworking, dedicated, the kind of person who rolls that computer on wheels down the hallway with focus, with purpose, because she has a dozen tasks to complete and just as many patients to care for. And I think she's not alone in that. She's thinking about dosage, documentation, deadlines. And as she pushes that computer on down the hallway into one elderly patient's room, she thinks, please don't talk long. Please don't, jabber on. Please just take the meds so I can keep moving. But not because she doesn't care, but because she's overwhelmed. Because the system, the pace, the pressure, it teaches even the most compassionate people to move fast, right? To be efficient, to check those things off the list. But life has a way of slowing us down. And later on, Kathy becomes the patient. She goes in for back surgery. She's hopeful she'll be one of the lucky ones, but the pain doesn't go away, it gets worse. She's sent home confused, hurting, and with no answers. And then things really spiral. Her fever spikes. Her husband finds her trying to fry paper towels in the microwave instead of bacon. Her body's on fire. Her mind's in a haze, and she's septic. She's rushed back to the hospital and into surgery. And now she sees the hospital from the other side of the bed rails as a patient. She sees the rushed nurses scurrying in and out of her room, never quite looking her in the eye. She sees the untouched empty water glass, the full trash bag on her food tray, the unanswered call bells, the silence that fills a room where care should live. And here's the thing, she doesn't speak up because she's scared. She's vulnerable. Despite everything, she's still that nurse who knows how busy the rest of the staff is and how hard everyone is trying. And yet she feels really invisible. And now, sorry, but that's where the moment is, the powerful moment where the lesson lives, right? Because in that silence and in that fear and in that loneliness, she remembers what it feels like to be on the other side. And so now when she walks into a room, she sits, she looks into the patient's eyes, she listens. Not because it's written on that checklist, but because she knows really deeply what it means to feel unheard. And that's the power of empathy. It's not just about feeling. A lot of times people are like, oh, it's about emotional. And if I do that all day long, I'm not going to be able to make it. I'm going to have compassion fatigue. But it's not just a feeling, it's not just kindness. It's presence. Empathy is presence. It's saying, I see you, you matter, and I'm here. And in healthcare, it's not extra, it's not fluff, it's not the icing, it's the whole cake, really. It's not one of those soft skills. It saves lives, it restores dignity, and it can turn pain into healing. And so when we're tempted to rush past a moment, we can remember Kathy's story. I think it's a great one. And it's probably not a solitary story at all, because sometimes the most important medicine doesn't come in a shot, in a vial, in an IV bag. It comes in a chair pulled up beside a bed, in an open heart, and a willingness to say, tell me your story. Okay. So before I go to the next slide, I'd like you to put in the chat, uh, when you hear the word empathy, or when you saw this, this is going to be the webinar today. When you hear the word empathy in healthcare, what comes to mind for you first? Is it emotion, skill, or action, or something else? So just put in the chat. You don't have to wait. You can just put it in the chat. Maybe I can. And Carl, can you read some of those off for me?
Absolutely. I was about ready to ask. Yeah.
Yeah.
Emotion and outcomes, walking in someone's shoes, active listening, compassion, emotion, emotion and supportive care, understanding, and honoring each patient's unique self.
Wonderful. That's great. Thank you. All right, so let's just go to the next one here. So maybe I'm preaching to the choir here, but there, we can make a case for empathy that, like I said, it's a core skill. It's often in a lot of education curricula. It's put up, it's like a soft skill. It's something extra. It's something, it would be great if we have it, but if we don't have time because we've got to focus on the science. But it's a core, and there's all of this that I have here. There's tons of research, evidence-based research, that it's a core clinical skill and a relational practice, not a soft one. That it's a evidence-based competency essential to effective humane care. Not surprising that it's measurable, teachable, and sustainable. And I think that's a big one because a lot of people, and myself included, before I started doing all this work with Stony Gate and with the nurse narratives, really thought some people are just born more empathic than others. Now, some people are born with that as a trait, but it is something that is teachable, and it's measurable, and it is sustainable. And that's exciting to know that we can teach it and practice it and improve our skill set. I think a good definition is it integrates understand. So it's not just that emotional connection, but it integrates understanding, mindful presence, which several people said, active listening, that kind of sense of curiosity. Tell me more, right? Just even, yeah, just tell me more about what's going on. Tell me more about what you're afraid of. And that emotional attunement that translates really into compassionate action. And definitely there's tons of evidence that it's linked to improved patient satisfaction, adherence to care, and to clinician well-being. And we'll talk about that some more in just a minute when we get further along. And I think probably I'll see you all, or most of you, at the all staff meeting later, and I'm going to click through some of the resources and the research, and so you'll see some of that. I'll show more of that there. So as a clinical competency, it involves it's cognitive. It's not just the emotional, the cognitive, emotional, and that kind of actionable items, behavioral ability to both perceive and interpret, what the patient is feeling, some of their concerns, their fears, where they're coming from, the who they are that they bring into the room, their own lived experiences that impacts the way that they hear what you're communicating, the way that they understand their healthcare. And then to be able to communicate that understanding. I hear that this is what you're experiencing, or these are some of your concerns, just, to communicate. And it doesn't take a lot of extra time, but to communicate that understanding in a way, in words, in a tone that the patient or your colleague, because it's also empathy between colleagues, feels really heard. And then to use that understanding to then guide compassionate, effective clinical decisions and care actions. Okay. So I think this has come up several times when I've had conversations with people. Nurses are known for being the most trusted profession, that people that go into nursing and hopefully people that go into healthcare in general want to make a difference, feel that they are empathic people and they care about patients. What is not, I think, as commonly known or appreciated is that there actually really is a compassion crisis in healthcare. There was a recent, I'm sure many of you are familiar with the Schwartz Center for Compassionate Healthcare. There was a survey of over 800 patients, I think, from across the country, and that less than 50% of hospitalized US patients believe that the system actually provides compassionate care, that their experience was not that. I don't think I think that's all over the world. I don't think it's just in the US, but it definitely is a crisis in the US. And there's also, and this especially with nursing students, a lot of the research shows that there's a discrepancy, and with surgeons, with nurses, with people that have been in practice, that between the provider self-assessment and the patient perceptions of their empathy. And so this crisis, a lot of people feel like, oh, because we're overworked, we have too many patients, we have too much reporting, we have all of these things that we have to do, we don't have time. We have a large patient load, we don't have time to practice that. But one of the things that we'll talk about in a little bit is that the compassionate care and practicing empathy actually reduces compassion fatigue and reduces burnout and increases healthcare provider resiliency. But it also improves patient outcomes in a way we'll talk about in a minute as well that's pretty impressive as much as medications, right? But it's really still undervalued in training. It's often in a module here or there, an empathy intervention. Maybe it's in the communication class in undergraduate nursing. And I'll just interject because I saw that a couple people said they wanted to learn a little bit more about nurse narratives. This is because of all of this research, this is one of the reasons that we're not only doing the stories, we've started out with the stories as a component. We're working with nurses in Ballad Health, working with faculty and students at ETSU and at a few other universities in the region. But now we're taking that collection of stories and integrating it into the curriculum, working with faculty. Tabitha and Michelle are both have been some of our pilot faculty really saying, what are we already doing and how can we integrate this more extensively throughout the curriculum, emphasizing that it's a core skill, not just a soft skill. Another fact that's kind of alarming is that without the formal empathy training in nursing schools and med schools and schools of public health, that actually students' levels of empathy decreases by the time they finish their program. And then it continues often to go down from there while they're, when they start to work. If there aren't practices in place and if they haven't learned some of these skills that they can rely on when they go into practice. So there's a real need for integrating it into the curriculum. And into the hospitals. We can do all we can from the educational standpoint, but if we don't begin to work on empathy intervention and practice in hospitals and clinics, then it's going to be one-sided, right? So some of the measured impacts for both patients and providers. There's physiological impacts, psychological effects, improved patient self-care, so motivation, and of course, overall quality of care. So a couple of examples, and these are also measured. Empathy can modulate a patient's perception of pain. There are measured endocrine effects, improved blood sugar, with patients with diabetes. There's an enhancement of immune system function. Patients are more likely to take their medication. They're more likely to follow protocol. They get off their pain meds more quickly. It can have a relative effect, a similar effect as a certain level of morphine, which is amazing. And recovery time is reduced. So those are pretty powerful physiological impacts of empathy. Patients trust their providers more. There's a higher level of satisfaction, which leads to things like improving more quickly, following protocol, that sort of thing. But for nurses and for other healthcare providers, it reduces burnout. A lot of that is, I think, a couple of things. It reconnects you to your sense of purpose, your why, for why you went into nursing in the first place. I think, when you're practicing compassion with your colleagues and vice versa, there's a sense of being heard. There's increased resiliency and decreased compassion fatigue. And enhanced team performance and job satisfaction when you feel heard as a team. And we'll talk about some of the ways that we can put that into practice. I think even just in the nurse narrative sessions that we've had, and maybe Tabitha and Piming and Michelle can say something to that. But I think one of the things that came out of some of those sessions, not only in the storytelling sessions, but in looking at developing the curriculum and working together as a team and sharing stories about experiences, really helped build trust and helped build respect and a sense of team and companionship and sense of collegial interaction and communication. Tabitha or Michelle or Piming, do any of you have anything that you'd like to say about your own experience with practicing some of these things in some of our sessions with nurse narratives? Since we're a small group, we can do it.
I think for me, it's just making it obvious that we're all human, and that, not only do we need to be empathetic with our students, but also and with our patients, but also with one another.
Mhm.
And I think it really made me realize that everyone has a story, and how impactful those stories can be when they're shared, among your colleagues.
Mhm. Yeah. Thank you. Anybody else want to, Michelle or Piming, do you want to say anything?
I would have to agree with Tabitha on that. Empathy is just kind of an innate nature for me because I'm always wanting to look at the positive side of everything and I always want to be supportive. But I think sometimes where life gets so busy and you have such a trouble with work-life balance that you forget some of those things. And I think going through this probably helped reunite me with the importance of it. And regardless, think of that person as a person, not always assuming that, they didn't do what they were supposed to, or that there's truly a reason behind things, and that we need to be more patient about that and just not assume the worst. And it's very easy to fall into that, especially when you're stressed yourself and you've seen things happen in the past, you just assume. And I think that that's one thing that this brought that more to my attention that, we just need to all stop and think about things and be patient and understanding.
Mhm. Right. Thank you, Michelle and
I
Tabitha.
want to share if my experience is love. We know the love is from God. So LOVE, love. First, the L is listen to God's words. So your heart will tell you something. But the heart tell you must understanding is positive because the devil also will tell you something. So you must understanding the voice is from Heavenly Father. So it's positive words. And then so listen to God's words. O is observe other people's needs. So when we understanding other people, they need something, will inspire us to think about how to help others. V is like receive the vision because the God will give you some vision to help other people. E is eye opening. Your eye have a spiritual eye, so your heart, your eye inside will opening, so you can have empathy. Okay, so this is I want to share LOVE. Thank you.
Thank you, Piming. Great, thank you. Yeah, and I think I noticed from one of the outcomes from some of these sessions was that there was a lot more ability to collaborate with colleagues, not just focused on individual courses and all the things that all the meetings and things, but really finding ways to collaborate because of maybe some improved communication and, as Michelle said, understanding your colleagues in a different way. So but there are a lot of barriers, and some of them are barriers that are perceived, and some of them are very, very real. So I'd love to just, if you guys would just put in the chat, some of the barriers that you have experienced, as a practicing nurse, even, or as a faculty, nursing faculty, or that, would be some of the reasons people would say that it's really hard to practice empathy and compassionate care. So your thoughts about that in the chat, and then maybe Carl can read those out.
Right now we have time. The healthcare system is broken. The actions of others put defenses up. In the work setting as a nurse, it is time. You must do more with less, but it is difficult. Uncertainty of how it will be received.
Great. Thank you. All very thoughtful, very real barriers to practicing empathic care. So yeah, exactly some of those. Time, there's a limited time for listening, no time for reflection or presence. There's all these competing demands, right? I think several of you mentioned in some of our sessions that hidden curriculum. This, that happens once you tell students that this is important, and then they get on the floor at the hospital and it's, the role models maybe aren't practicing what they've been taught. I'll just say it that way. But the evaluation systems, right? That we prioritize efficiency and technical performance over emotional awareness and relational care. Another one, this lack of psychologically safe spaces. I think that kind of relates to what somebody said, like how it will be perceived. Is it safe to, how will people understand my practice of empathy or the way that I'm empathizing? And then of course, is if I practice it too much, if I tap into that, I'm going to burn out. There's moral distress, right? And compassion fatigue, which we've already talked about. And then the big one, yeah, the system level misalignment, right? That the system is broken in many ways, that there's productivity measures, organizational structures, leadership priorities that don't always reward reflective practice or at all, right? And so it's harder to sustain. So we'll talk more about in a minute some of the ways to, or some practices to help overcome that. And a lot of these are things that we're trying to implement through nurse narratives. But so I will not just be talking the whole time. I would like to have you guys, I'm sure you saw it coming, knowing about nurse narratives. I'm going to show a story. I don't know if you all has anybody seen this story by Ned from Ballot Health? Yeah, some people have. All right, well, I'm going to show it for people who might watch the recording, or for some of those of you who haven't seen it. But this is a story from one of the nurse narratives workshops. And so I'm just going to play it, and then I'm going to ask you all to do some writing. So we'll play this first.
Roberta stopped me outside of room 2607 and said, "Ned, I heard that the family is on the way. Page me when they get here. I wouldn't miss this for the world." I breathed a sigh of relief and said, "Thank you so much for making this happen." She replied, "You were the one who wouldn't let it go." From the very beginning in nursing school, our instructors drilled into us, become the patient advocate. I wasn't really sure what that meant. Early in my nursing career, when I was as green as grass, I was the senior nurse on duty one night when a teenager was brought into ICU post-op from emergency surgery. As I pulled the soiled linen out from under him, I observed rivulets of blood coming from his bandages and onto the fresh sheets. The words just came out of my mouth. I told the surgeon to his face, "You need to take this patient back to surgery." There was an almost audible gasp in the room. Who was I to tell the surgeon what to do? He didn't take him back to surgery, and the outcome was not good. For years, I wondered if I should have tried harder and not let it go. Back in room 2607, I got the call that the family was downstairs at the back entrance. I notified Roberta just before escorting the patient's mother and sister up the stairwell to the unit's back door. Each one of them carried a small dog beneath their jackets. Day shift and night shift were in the process of changing, and several of my colleagues were present, as well as Roberta, the night shift supervisor. The family kept thanking us over and over as they gently placed the dogs on the patient's chest. They didn't have tails, but if this breed did, they would have been wagging. They were also very generous with their canine sugar. They discovered his tears and licked his cheeks. There was not a dry eye in the room. After 10 or 15 minutes, the dogs settled down, each one laying between the patient's chest and his arms. The patient was almost paralyzed, but he somehow formed praying hands above his chest and silently mouthed, "Thank you." Seeing his dogs had been his dying wish. I'm glad I didn't let it go.
Okay. So I'd like you to take just a few minutes, and I've got a couple of prompts here where you can write about a moment. Just think of a moment when empathy changed a patient interaction that you were involved with or that you observed, for you or for the patient. So write about a moment when empathy changed a patient interaction for you or for them, or write about a moment when a lack of empathy or compassion impacted the patient outcome or the way that you felt about your job. So whatever resonates for you. And we'll just take a few minutes to write and then tell you what's next. Normally, I would give you more time to write, and I do think that one of journaling and reflective writing is a really powerful tool. And as several of the faculty here who've been involved in nurse narratives will tell you that that's one of the things that we're trying to incorporate across the curriculum is we have reflection journals and an evidence-based reflection model. And so normally we would have a little bit more time, but I'd love if anybody, maybe if you want to put in the chat what it felt like to write about that, or if it was hard to come up with a moment, or if you had so many moments that that you couldn't pick one, or thoughts about how you could see something like this could be useful for students, but also for practicing nurses. And if you want to put into the chat what you wrote, you can do that as well. So any way that you want to share. If we had more time, I'd invite everybody to share what they wrote, but any of those things that you want to put in the chat.
So I'll go ahead and read what Belinda wrote.
Okay.
A patient grabbed me in the hallway of an urban clinic and hugged me so tight I couldn't see who it was. I had not seen her since I had talked her into letting me do a well woman exam. She had a mastectomy 20 years before and had not seen a provider since, and I saw that her bra was filled with socks. I had showed her how her Medicare would pay off proper prosthesis. It reminded me that we may never know who we touch.
Thank you, Belinda. Anything else that people want to share in the chat?
I'd rather just share mine out loud than try to
Go
get it
for it.
out.
Go for it.
Appreciate that. Yeah.
Yeah, so we had a patient when I worked in home health.
Oh, you just muted yourself,
Yeah.
Tabitha.
Sorry, we had a patient's husband. We were caring for his wife in home health, and a lot of the nurses hated to go down because he loved to talk. When you get there, they live fairly well, significantly in a significantly remote area, and he would always, before we came, prepare some sort of food, whether it was biscuits or cookies or some type of snack. And I can remember when I was training, I was accompanying a nurse. And when he offered the food, she was kind of snippy at him and just kind of rude, like I don't want it, blah blah blah. And later on, I was assigned to that particular household independently, and I remembered the look on his face when she wouldn't take what he had prepared. And, I'd heard her make a lot of comments in the office about, he always wants me to take his food and he's got dogs in the house and there's hair everywhere. Um, but I always took them. I may not have eat them, but I always took them because that was his way of repaying us for what we did for him and his wife. And not allowing him to do that and not taking that was not just a slap in the face, but it was heartbreaking for him. He would always ask, when I was training with the other nurse, why don't you want them or whatever, and she always came up with some lame excuse. But eventually, I just decided, what, that means a lot to him, and I'm going to take them, whether or not I eat them or not. I'm going to take them. So.
That's very powerful. Yeah, a really simple but super important gesture. Yeah, thank you. I'll tell a quick story. And if other people want to share an email, maybe we'll have some time at the end, but just in terms of time, and I know several of you have heard me share this before, but there was a story about a patient, and this is a real story. It was in a book I read recently called Compassionomics. And the patient, the nurse, one night nurse came in, opened the door really loudly, flicked on the lights, went over, kind of yanked down the sheets, checked his, IV and whatever else she had to do. And then left kind of in a rush and forgot to turn off the lights. And, just in terms of, and he complained about, I can never sleep here. How am I ever going to get better? And then another nurse, a different night nurse, came in and she quietly opened the door. She turned, took her phone and put on the flashlight and kind of quietly went over to his room, gently pulled back the sheets, took care of the IV and whatever else she needed to take care of, and then snuck out and closed the door. And he never woke up, never knew she'd been there. It did not take any longer. Both of what they did the same thing, and neither took longer than the other. And yet one was extremely empathic and compassionate, and the other wasn't. And so, there's this idea, I mean, the time issue is real, but there are places, where you can spend 1 minute more and reflect back to what a person, a patient has said, using communication skills. And there's all kinds of little small moments. And there's research on that as well, that it's like a 40-second intervention, communication intervention that can have an impact on patient outcomes and patient perception of their compassion, of whether or not they had compassionate care for months and months afterwards. So there are small things that we can do. So let's go to the next. Recognizing that we don't have a ton of time left, but a few things. These are some things that can be implemented. So creating space for reflection. We're doing that in some of the classes. Encourage nurses to do it, and that are so integrating short reflective pauses or storytelling sessions into rounds. I mean, it can just be even a couple of sentences, right? That's not you don't have to take a long time to classes and to meetings. I know that one of the nurses or one of the CNOs at one of the Ballad Health hospitals is going to start sharing some of the nurse narrative stories in her staff meetings, and then having some space for people to talk about their own experiences, what that brings up for them, and just use those as kind of teaching tools, but also opportunity for the team to reflect and share. So encouraging journaling is another one, narrative sharing or short debrief circles, kind of like Schwartz rounds, which I'm sure many of you or all of you are familiar with. Building psychologically safe forums. Again, Schwartz rounds are really powerful, or empathy circles, right? Where staff can share experiences without judgment. And then I think normalizing vulnerability and emotional honesty as strengths, not weaknesses, is really important, especially in the current environment that we have right now, especially in the US, that those are strengths, not weaknesses. Teaching empathy as a skill, a core competency, which we're doing. Embedding empathy and communication modules into nursing curricula and professional development. I think I've been talking with a couple of faculty at ETSU about maybe collaborating on some CMEs that incorporate empathy training. And then modeling and rewarding empathic leadership are huge. Leaders demonstrating active listening, compassion, and decision making. I know at Stony Gate they have these empathy pins that they award as for empathy champions. I think that's one of the things that we're hoping to implement at ETSU soon, where faculty who are integrating some of the empathy interventions can give students, award a student each semester with an empathy pin, making it something that people really want to earn just as much as they want to learn how to do those, take blood or or get that A, but to be recognized as an empathy champion. And then maybe even doing it when faculty take students to clinical rounds, and then students at the end of the semester award one of the nurses on the floor who really models empathy with an empathy champion pin. So those are small things that you can do to recognize and honor and reward empathy. So, I guess before I flip to the next slide, I'd love to hear from you all some of the strategies that you have or that you had when you were working in a hospital or a clinic, or that you still use as faculty. What is one practical strategy that you incorporate or that you can incorporate to sustain empathy in your own practice? I know as faculty, you guys, you not only are teaching a full load, you have to be on a bunch of committees, you have to be on the curriculum committee and attend a lot of meetings, and there's just not a lot of time for extra. So what is one strategy that you already do or that you could do? And maybe that's really about, some of that's about practicing empathy towards yourself, but also towards your colleagues or students or with patients. If you want to put that in the chat. Or
I
if you
think
don't
I
yeah,
think
go.
we can active learning, look active listening, just
Yes,
become a active listener,
yes, yes.
and also try to understanding. And before that, we can establish good relationship. For example, bring some treats for students, and then you have a good relationships with them, and you active to express you care of them. You welcome their question or welcome they ask for help. So they understanding we are open our mind, and they open their mind also. Yeah. Mhm.
Thank you, Piming. Yes, and Carla, there's some other ones in the chat as well. Thanks, Piming.
Yeah, Allison. First one here is, I think taking that extra minute is important. We can all find that one intentional moment for our patients, students, and colleagues. Service learning projects. Improving self-empathy is huge for me. Being intentional about how I spend my time. I try to instill more self-care for me so that I can be my best self to others, and then modeling empathy.
Great. Thank you. Those are great. All right. Yeah, so here are some of which you've already talked about, but just taking a couple of minutes to pause and reflect daily. This idea of story sharing. Again, it doesn't have to be creating a full-on digital story or writing a piece for a journal, but just really taking some moments, and intentional, I think, is really helpful, because it's not going to just happen in the hallway, but saying, let's find some time to share some experiences, to share some stories, narrative rounds, Schwartz rounds, however you want to talk about those. Like Piming said, that mindful listening, self-compassion, small acts of kindness, all those things. Bringing treats for students, they love that. And I think here's a big one. The next one is really something that back to the system, right, is thinking about how can we as individuals impact the larger system, and as leaders, administration, modeling empathy in action, building reflective structures, like the CNO that I told you about. I'm really excited that she's going to do that. I think that's a great model and something that they haven't been doing. So there are all kinds of things. They just take some intentionality and practice, like any skill. Practice doing it, knowing that you'll get better with practice. So we'll save a few minutes, but yeah, so I think just kind of some takeaways: that empathy is essential. It's not a soft skill, it's a core skill. It's something that we can teach and practice and get better at. And that stories, they really do build bridges. That simple act of listening, that curiosity. Tell me more about that. Tell me more about that. Reflective writing, that list story sharing and story listening. And that empathy also is for the healer. It's also for you as a provider, as a nurse, and that it's not just the empathy that you need to show to your patients or your students, but also your colleagues, but yourself. So that's all I've got for today. Well, that I could fit into an hour. So, hi, Lisa. Good to see you. So, any questions or any thoughts that you all have, things that you're already doing, questions that you have? I think Rhonda, you asked about a little bit about, want to hear more about nurse narratives. We have, 7 minutes. Is there anything else folks want to add or
Thank you
ask?
so much for everything you have done to improve our nursing, the empathy, and from recording the story and everything you have done. Thank you so much.
So welcome. It's been my pleasure. Thank you, Elisa. I appreciate you guys. I've the people that I know, I've already told them I want to be an honorary nursing faculty at ETSU. Just this last year and a half of working intensely with nurses, and particularly with the faculty, has just, my respect and admiration for nurses is just through the roof now, really.
Well, I think, thank you, Allison, for doing this webinar with us today, and thank you everyone for joining us. We truly appreciate your time, taking it out of your busy schedule to invest in your personal and professional growth. Your dedication to advancing your career and the nursing profession as a whole is inspiring, and we hope you're leaving today with valuable insight. So, but before we wrap up, I want to remind you that you will receive an email shortly containing your participation certificate and access to the webinar recording. Additionally, in that email, there will be a short survey, and we would greatly appreciate your feedback to help us improve and tailor future sessions like these. So, thank you again for your participation, and we look forward to supporting you as you move forward in your nursing careers. All right. Thank you all.
Thanks, everybody. Thanks,
Yeah.
Carl.
No problem.
Good to see everybody.
Belinda, I'll text you after this because it's recording right now. So I'll text you.
All right.
Yeah. All right. Bye.